In this module, we'll look at the various challenges that a counselor could encounter during the counseling process and how to deal with these challenges. These challenges could be due to the CAP counseling process itself. This could be challenges related to drinking goals or severity of the drinking problems, or these could be challenges related to the patient's presentation. First, we'll look at the various challenges. One of the challenges that we could commonly encounter is that the patient does not believe he has a drinking problem, even after you have done personalized feedback. What we need to ensure here is that we don't get into an argument with the patient. We need to focus on making him understand the advantages and disadvantages of drinking and then allow him to make the decision whether he wants to make a change or not. We could have patients who believe that just talking about their drinking problems or counseling will not help. We need to explain to the patient that counseling is a well recognized treatment for drinking problems. This is in addition to medicines if required for more severe cases of alcohol use disorders. Sometimes it might be that the patient expects to be prescribed medications. We need to be explaining to the patient and the family that there is no magic pill for alcohol problems which will cure the patient. Treatment primarily comprises of counseling, and medications are used only in those with severe drinking problems. Sometimes, due to practical reasons, patients might not be able to attend counseling sessions in your center. In such patients, we need to offer home counseling or counseling over the phone. Sometimes, even after scheduling an appointment, the patient is not able to make it. What we need to do is to respond as soon as possible and try to find out the reason why the patient missed the appointment. It's very important to communicate to the patient optimism about his capability to undergo treatment and reschedule the appointment as soon as possible. Many times, the patient does not understand the concept of working collaboratively and instead wants you to advise him or to generate solutions for him. When this happens, we need to explain to the patient the collaborative nature of the CAP counseling process. We also need to remember that it's possible to give advice to the patient, but we need to do it in such a way that the patient also has a say in it. Many times patients feel very uncomfortable talking about himself and his problems. We need to gently draw out such patients and respond helpfully and encouragingly so that he starts feeling more comfortable. You can find more details about how to do this in the Counseling Relationship Manual. Many times the patient himself does not want to attend the counseling sessions and gets forced by family members to do so. In such cases, the patient might feel resentful and be uncooperative during the counseling sessions. In such cases, the first thing that we need to do is try to get the patient to reflect on why he has been forced by the family to come for the counseling session. Now we look at some of the challenges related to drinking goals or severity of the drinking. Sometimes patients might choose a risky drinking goal. You might believe that this might not be the wisest course of action, but you need to be respectful and supportive of the patient and his goals. At the same time, we need to communicate to the patient that you are concerned about the goal that he has selected, but you need to do this in a compassionate way. One thing that we don't want to do is to use demotivating techniques like lecturing, warning, or humiliating the patient so that the patient chooses a drinking goal that we think is right for him. We might get patients who have alcohol dependence. In such patients, we need to conduct the first session and then refer the patient to a psychiatrist. If the patient undergoes detoxification for his alcohol dependence, we can continue with our counseling session simultaneously as soon as the patient is physically fit to undergo a counseling session. Sometimes we might have patients with severe physical or mental health problems. For a patient having severe mental health problems, we need to refer him immediately to a psychiatrist. And for someone who has physical health problems, we need to refer them immediately to the medical officer or GP in the primary care center. And then there are challenges that we need to deal with, which are related to the patient's. So, for example, we might have a drunk patient coming to a session. Just because a patient has had a few drinks, it does not mean that we can't conduct a counseling session. We need to not conduct a session only when the patient is showing obvious signs of intoxication. Even if the session has to be cancelled, have a brief discussion about rescheduling the session as soon as possible. Give the patient an appointment card so that he does not forget once he gets home, and then follow that up with a reminder phone call. Sometimes you might get a patient who is hostile. We need to remember that the counselor's safety is paramount. Hence, we do not get into a confrontation with the patient or inflame the hostile behavior further. We could try to help control the patient's hostile behavior using verbal de escalation techniques, but if we feel unable to do so, we need to withdraw from the situation. You might also get a suicidal patient in one of your sessions. Important thing to remember while handling such patients is to conduct a detailed suicide risk assessment. Assessment of risk should also involve assessment of protective factors. Once you have done the risk assessment, plan an appropriate action, and this could include timely referral to a psychiatrist for further management. Sometimes we might come across patients who make unnecessary advances. Any kind of advances made by the patient are unacceptable. If the patient makes such an advance, tell him to stop immediately. Tell him that you will stop the session if this continues. Despite this warning, if the patient still continues, stop the session and discuss with your supervisor whether to offer another session or not. Sometimes we find that family members interfere in an unhelpful manner during a session. When that happens, we have to request them to listen to the patient first, following which you will give them an opportunity to speak. If they continue to be difficult, you can ask them to wait outside your counseling office while you conduct the session. You could reflect the situation back to the significant other. And in case of home sessions, if this kind of interference continues, you need to discontinue the session and schedule a session in your counseling office. Sometimes you might set a homework for the patient to do between sessions. You might find that the patient does not do the homework at times. The solution that you will implement will depend on the reason why the patient is not able to complete the homework. If the patient is illiterate, you could complete the homework together during the session. If the patient does not understand the rationale behind doing the homework, you need to then clearly explain why they need to do the homework and how it will help them.